Life sometimes come at you fast. Tragedies make your life unravel. You feel like you wanna give up and stay knocked down. Even when your heart is shattered, you still got a life to live. You still got a life to live, so don't give up. We are beautiful miracles. We are beautiful miracles. We are beautiful miracles, so don't give up.
Hello, everybody. Thank you for joining me on my podcast, Beautiful Tragedy. And if you like what you're hearing, would you please comment, like, subscribe, and share this podcast so we can get it in front of people who need to hear this. On today's episode, I'm very excited to have Dr. Ann Lingg, and she is my son Ivan's play therapist. And she has her PhD, and she is a licensed professional counselor who uses play therapy in her practice. So thank you so much for joining me, Dr. Lingg. And I know that most anybody who knows me knows that I'm basically the president of your fan club. So if you wouldn't mind, would you tell us a little bit about your background and why you work with children?
That's a good question. I thought about that on the way over today. I've always known that I wanted to work with children. I wasn't sure why, but I've always known that. And as I thought about it on the way over today, I thought I was a handful when I was a child, and I never felt understood or like you're not getting me. And there was something within me that as I grew up, I knew I wanted to work with children to make that happen. I didn't know what it was going to look like.
Yeah.
So I ended up being a high school teacher, taught in high school for about 7 years, and decided I didn't want to do that for the rest of my life, so I went back to graduate school. I got a master's in health education, and when I was doing one of my electives, I took a course in personality theory and development, and it was like one of those things, I don't know if you've ever had this experience where you just, like, I'm home. I found my niche. Mm-hmm. I know I have to keep going.
Yeah.
So before I finished my master's, which I did, I looked around for a PhD program, and in the same town of Denton, Texas, at the University of North Texas, I found a wonderful PhD program in counseling. And that's what I started, and it took me about 5 years to complete. But I did, and then I still wasn't working with children, but I wanted to be a professor.
Okay.
So I ended up at the University of Missouri St. Louis teaching. And I left there after 7 years and decided, what's next? Mm-hmm. So that's when I opened my private practice and decided I need to work with children.
Well, you're very good at it. So how long have you been doing that?
I've been in my office now for 24 years.
Wow. Yeah. Wow. And so how did you get into play therapy, or, again, I guess what drew you to, I don't know, I guess like you said, you wanted to be more understood. So like, I feel like you do that with the play therapy. So explain a little bit kind of how you do that.
Sure. And let me tell you, when I was doing my PhD program, there was, they had an incredible play therapy program within our counseling program.
Okay.
Which I did not follow, but I happened to work at the clinic there, so I was around it all the time.
Right.
So I decided, okay, that's what I'm going to do afterwards. So play therapy is an approach to counseling that fits with children because they can't always verbalize. Most often they can't verbalize what's going on inside of them, what they're feeling, but they naturally communicate through play. And so when you have a room that has very specifically chosen toys, a child will naturally gravitate to that which they really need to process.
Right.
So in a playroom, you have nurturing toys, scary toys, expressive toys. You have all kinds of different kinds of categories of toys.
Right.
And they are always put back in the same place. So a child, when they come in, they know exactly where everything's going to be, because we know that stability, that predictability, is very comforting in its security for children. They need that that ability to walk in somewhere and know, I know where the truck is, or I know where the house is, I know where this is, because then that's security for them.
Right. Now, I know one of the activities that we used to do with Ivan was the Easter egg hunt. So it kind of explained how that is, something that is helpful for someone like Ivan who is anxious.
Sure. Again, kids can't always verbalize what they're saying. So I decided kids like Easter eggs. They like to have an Easter egg hunt.
Right.
Why not make it therapeutic?
Right.
So I took a lot of plastic eggs, and what I did was either I put a little treat in a couple of them, or in most of them have notes, as the kids call them. And on the note, it might say, tell me your favorite ice cream. And they get started talking. Mm-hmm. Another note might say, then get into something more. What's something that scares you? Or what's the biggest worry that you have? Or tell me something that you're proud of.
Right.
So it's a prompt for them to be able to talk about what's going on.
And in a play therapy session, do you guide their play, or do you kind of let them make their decisions, and kind of how does that work?
I'm probably both. I'm directive in that I might do a game like the Easter egg hunt, mm-hmm. or we'll do. I might have them draw a picture, but I'm also non-directive in that I let them develop the relationship, was so extremely important in therapy, right, as it is in adult therapy, but also child therapy.
Right. I know that sometimes, Ivan would want to play with the hospital, and, there would be times where, for me, kind of overhearing some of the stuff that would go on, kind of stabbed my heart. But at the same time, it was like I realized that, it was something that he really needed to process. And that's something I see a lot with Ivan, where I can tell when he's kind of got something pinging around in his head and he just can't make sense of it. And so, I definitely reached out to you in those kind of situations, because I'm like, well, I don't really know how to help him process. And I feel like that's one of the biggest takeaways for me, is that you have given him the tools to help him process, and so obviously I know there's a lot of psychology behind all that, but is it just the safe place, the playing, and
It is the processing that, when Ivan would play in the hospital and somebody would be sick and he would make sure they got the attention that they needed. He's working through his brother's death.
Right.
It's not about this little guy in the hospital. It's about what is here. But he doesn't talk about Jackson. He talks about this child in the hospital. And so one of the beauties of play therapy is that they can be once removed from what they're dealing with, and it's not as difficult, it's not as scary.
Right.
So it really allows them to work through something without being in their face.
Right. And what do you think the ages, that it's most ideal for a child to do play therapy?
Play therapy is anywhere I've done as young as 2.5 up to 11 or 12, which is getting up on the high end of the age. But I also do sand tray therapy, which is extremely, extremely powerful for all ages, adults as well. I do it with adults as well.
Wow.
But I have several different sand trays, and there's just a plastic box of sand, and I have about 2,000 miniatures on my shelves that the kids can choose from and create worlds in the sand.
Right. And what could one of those worlds mean for a child? Let's say if they have a fence set up, what does that mean?
It's not always a prescribed what you're going to get out of it. It's not, this means this
right,
means that. But typically, if you have a sand tray that has, say, animals or people in it, and then they're fenced off, could indicate their need for safety, their need to separate something from each other. Depends on what they're dealing with. But bridges, for instance, I see that a lot, means transition. tends to mean transition. And almost always, if I have a child in transition of some kind, they'll just automatically put a bridge in their tray.
It just really shows like how like wise they really are, and like how much they can tell you without telling you, because we want to know, we want to help, but like when we don't know how to interpret those things, you know, as a parent, you can feel very helpless. And, you know, as I've said before, there are no guidebooks on parenting, and there definitely are not really any clear guidebooks on there on how to help a grieving child. And, you know, for me, when we would come weekly, you know, you were helping Ivan, but you also helped me, you know, just with something that I could feel like I could do one thing for a week, you know. And, you know, now for me that it's been 2 years, it's still very hard. And we're in, you know, each, you know, phase is kind of a little bit different, but it doesn't feel as impossible for me now. And I just can't really say that enough to people who might be thinking about, does my child need therapy? Because I mean, I don't know really how a child could go through something like death of a sibling and not need therapy, you know? And it's not meant to, you know, condemn anyone who doesn't take their child to therapy, because, you know, I mean, everybody kind of has their own thoughts and ideas about therapy, but we've seen such a huge change with Ivan. And, you know, he was going to school and was just terrified that I wasn't going to come back. And so, you know, is that a pretty typical behavior that a child might show if they've had kind of a traumatic death like that, you know, worried about their caregiver not coming back? If so, and then also could you share kind of some other maybe typical things that a child might show?
Absolutely. I think, talking about Ivan particularly, that he demonstrated very common symptoms of a child who is grieving a death, because children understand death at different ages and in different ways. For him, he was at that age, about 3.5, that it was still like, you can't comprehend it. Mm-hmm. Is he coming back? Why isn't he here for dinner? All of those things. So when he's not there, his brother's not there, he worries about other people not being there. Yeah. And so you would see a child be very clingy. Like, where are you? Like, not being able to move in the house without them knowing exactly where you are. If you run to the grocery and they're left with another parent, when are you coming back? Are you sure? Please don't go. Those kind of, they just are confused.
Is that kind of like, you know, you talk a little bit like with psychology about like fight or flight? Like, I mean, is that, you know, like obviously his nervous system's kind of like on overload, and like over time through processing this, it feels like that's calmed down to a certain degree. But right. I mean, he still absolutely has anxiety, but is much more manageable now. Mm-hmm. And I mean, some of that is like, you can't really help that that's what your body does, you know? So again, can you share how play therapy helps with anxiety?
Mm-hmm. And anxiety and grief are very connected. Grief is a process, and anxiety is really fear. And so with grief, there are a lot of fears that come with that. What will happen to me? What will happen to my loved ones? Who's going to take care of me? And it's very egocentric, but it's very normal because of that age. Mm-hmm. And as they, you know, who's going to pick me up from school? So play therapy helps because they can process, as I mentioned before, they pick only what they need. And for grieving children, some of the themes that you'll see is they'll play in the house, and you know, they'll be talking about going to bed. Well, I don't want to go to bed. You come to bed with me. Those kinds of things. Or you'll see a theme of burying in the sand, where they bury something and they don't want to look at it. And then they want me to uncover it. So we learned how together how to uncover those fears.
Wow.
I'll never forget one time I had this has been so many years ago. I had a little girl, and she came into the playroom one day, and I have this shelf of all these huge animals. And she said, all those animals, they've got to go. I said, what do you mean they have to go? Well, they got to go. They're just too scary. And I want you to take them off and get rid of them. So kind of directive.
Right.
So it was about 3.
Mm-hmm.
And I said, I can see those are kind of scary for you, but I won't know exactly which one's the scariest unless you help me. So you don't want to do it for them. So she would point, and she goes, okay, that one. She would take them all. Well, in the next few minutes, she took every animal just about off the shelf. She had put them over in the corner, and all those scary things kept going away. And finally, she looked at one, and she goes, and that pitahotamus, it's got to go.
Aw.
I love that story. But then I had a dancing scarf in there. I don't know if you know what a dancing scarf is.
Mm-hmm.
She took the dancing scarf, she took it over, and she covered them all. And she made all the scary things go away.
Aw.
So it's very metaphorical. It's the process that she could maneuver that, and she could master those fears by putting them over there and covering them up.
Yeah, and I mean, I see so much too. It's like, with Ivan, obviously he had no control over the fact that his brother died. And I see sometimes he really has that need for a sense of control. And it seems like when he's playing, he gets to make all those choices. Because sometimes when you really sit and think about the fact that kids don't really get to make a lot of choices themselves, it's like, no, we're going here, we're eating this, we're doing that. And so, I can see sometimes when Ivan really kind of needs that sense of control. And I wanted to talk a little bit about some of the resources that you have for kids, whether it be books about death or just how to help them with their anxiety, because as a parent, it's been a very helpless feeling for me because, we want to help them. We want to take care of them. And sometimes, this stuff is bigger than what we can do. And knowing that there are resources out there for people, I really want to make that connection because I was really, reaching and looking and trying to find stuff. And, sometimes it was a good resource and sometimes it wasn't. And so obviously this is what you do. So would you share some of the resources you have?
Sure. And not all resources work for everybody.
Right.
And so you have to. But I think, first of all, I want to mention that 1 in 12 children under the age of 18 in Missouri will experience the death of a sibling or a parent. That's a lot of grief.
That is.
That's just in Missouri. I did look up the U.S. It's 1 in 14.
Wow.
1 in 14 children under the age of 18 will lose a sibling or a parent. That's not a friend, a grandparent, an aunt, an uncle, anything like that.
That's crazy.
The
That's a
need
lot.
for grief resources is vital, and it's critical.
Yes.
Because we also know through research that unresolved grief has long-term effects on their academic development, their social development, their psychological development. It gets stuck, and there's the trauma that gets unresolved. Mm-hmm. And so ignoring grief in children, it just can't happen. Mm. So there are resources. Yes. For parents who are also grieving, it's very difficult. Mm-hmm. So it's okay to ask for help.
Yes.
It's okay to ask for help.
Yes, and like we were talking yesterday, it doesn't make you a bad parent if your child needs therapy.
That makes you a great parent.
Yes.
Because you know that you can't handle your grief and your child's grief completely at the same time.
Yeah.
It's so overwhelming, as you've experienced.
Mm-hmm. Mm-hmm.
So you need to reach out.
Yes.
There are some great books. I brought some today.
Yes.
One for families and parents. This is the Healing a Child's Grieving Heart, 100 Practical Ideas on What to Do. And it's something as simple as let the child feel what they feel. Because oftentimes, it's just like you can't deal with it and you don't want to deal with it. And it's like, I just need you to go over there and play. And they get dismissed. And then they learn their feelings aren't important. So that's a really important one.
Yeah, definitely.
For children, there are so many good books. This is Chester Raccoon's Acorn Full of Memories. I have a list, too. I don't know if you can put it on your site or whatever. Jungle Journey is really good. This one is good, too. I like because Eleanor the elephant is the one that usually keeps everybody safe. And then they don't know what to do without her. And then they all step up, all the different animals step up and go, well, I can do this, I can do this.
Yeah.
And so they find their own resources within themselves to come together.
Yeah, I like that.
Rabbitiness is wonderful. It's about a rabbit that loves to hop and jump, but he also likes to paint and make music. And it makes all the other rabbits happy. But one day, Rabbit isn't around anymore, and all's left is a black hole. And they go to find him, and he's not in there, but what he left was gifts for them. And the gifts were the paint and the music. And then all the rabbits remember the rabbit very well, and they're happy. And so he left them something.
That's sweet.
So they're just so many different ones. Ida always is another one about two polar bears are always together, and then Ida gets sick and dies, and how he handles it.
Now, is there, I guess, are the books about animals because that's sort of easier for a child to digest? I mean, obviously, when you have a sibling die, you don't have a lot of room to be real fluffy about it, and I know that, talking about animals is a little bit more gentle. Do you think that's the reason?
I think it's helpful because, again, children can only handle emotional pain in very short spurts.
Yes.
And so if you're always talking about their situation, they can't deal with it.
Right.
They can do in little bites.
Yes.
They can take this in easier.
Yeah.
And then they take away from the story what they need.
Yeah. Yes. And I remember Ivan would be playing, and then all of a sudden he would kind of come out with just something like, I remember when Jackson had a tube down his throat in the hospital, and then just back to playing, and it's like, I remember that you told me, it's like they can only handle being uncomfortable for short amounts of time. And so, like, to understand that it just is better in small chunks like that. I mean, sometimes
Absolutely.
I probably, just wanted to make sure that he was understanding, but that's, as a parent, you don't always understand that, the developmental part of it, at their age, they can only deal with so much,
They can only digest so much at a time.
Yeah.
I don't know if you remember one time, it was in the last year, y'all came in and you were had been talking about Jackson, and you had said to him, because he had been talking about something, and you said, do you want to share something with Dr. Mary Ann? And, and when you left, and he went out the door, and he came back, and he lifted the mailbox.
Oh, yeah.
Flap and said, Jackson died. He had a stroke.
Oh, gosh, I forgot.
Do you remember now?
I do now.
And that's what he wanted to say, but it was on his terms.
Right. Oh, he definitely does things on his terms.
But that's how kids do.
Yeah.
And if you try to force them into that, then it becomes a power struggle, and then they don't get that space.
Right.
To be able to handle it.
And I think, too, sometimes someone who's not in the home all the time, once you have that relationship with him, he might be able to share things more, where if it was in front of me, he may or may not want to. I mean, sometimes he feels comfortable with sharing stuff in front of me, but sometimes he doesn't, and that's okay. I mean, I've learned how to just kind of give him that space, and, we could always tell when he would go weekly, and then we would try to go every 2 weeks, and then sometimes that didn't work, and whether that was him or me, but, kind of really following his lead on that, and, just giving him the space, which I feel like, like my parents' generation, it was like, you don't talk about it. We just kind of shushed him, and now we're trying to do better about, giving him that space. And, I've also learned how to kind of respect where he's at. Because I remember one time he said, Mom, I don't want to talk about Jackson all the time. And it was kind of like, ugh, because I just didn't almost even realize how much I was doing it. And I never want him to feel like he can't measure up or he can't live up to that, So, even though it hurt my heart to hear it, I'm trying to respect where he's at. And just giving him a space to talk about it has been, something that's bonded us. And I think that he's, it seems that he feels pretty comfortable talking about it. And, like when I first, when we were around friends and stuff, I said, I'm just going to let you know, Ivan does talk about Jackson. And, so in some ways it was hard because it kind of forced parents to have conversations with their kids. Because a lot of times, you don't really have those conversations until something happens. Right. Do you recommend people discussing that kind of stuff before something has happened?
I think there are many opportunities to talk about death and dying prior to somebody or a dog. So, if you have a pet that dies, or you see a dead bird out in the yard, or you might see something on TV, or you look at some of our movies where Bambi, when we were kids, died. So there are many opportunities to introduce that along the way before an actual death in their life occurs.
Right.
If you take it.
Right. Right. Because then sometimes you're forced into those situations and you panic, because you don't know what to say. And, I know that not everybody is willing to face it head on quite like I have been, but I also have seen the benefits of being more honest and open, because now it's not a real uncomfortable taboo topic for him, they say kids are resilient, and they'll be fine and they'll get through this, and I just wonder what your thoughts are about that.
I think children are resilient as long as they have the support they need to get through. Because resilience is about being able to get through a crisis that they've never met before. But if you have a small child that experiences a death of a loved one, they don't have the life experience, they don't have the cognitive ability to deal with it.
Right.
So they may look resilient, like everything's fine, but if they're not dealing with the grief and they don't have help to do that, it's still in there. So yes, kids are resilient, but they need help, and they need to have coping strategies.
Right.
And you were talking about resources before. If I could go back there
yes,
for a
please.
second, we were talking about books, but there are also other places that you could go. Individual people like myself, your organization that's now helping children. There's and you do work with kids so they can go to individual work.
Right.
But there's an organization here in town also called Annie's Hope. And Annie's Hope is a center for grieving children, and we focus on children from 3 to 18.
Okay.
And it's all group work.
Right.
The support groups are. But we also have family social nights. We have family events. We have camps and retreats. So that is an organization that exists solely to help children through the grieving process.
And that's of any loss.
That's a loss through death, not just they had to move homes or move out of town or their parents got divorced. A death.
So could that even be they're upset about their pet, or is it more so a family member?
It's not. We've not included pets, but it's through a family member or even a very close friend,
right.
that a family friend that they were very close to.
Right.
But it's a person.
Right.
So.
And so what do you want parents to know if their child is struggling with anxiety? Because sometimes I feel like parents maybe think that if their child is behaving a certain way, that maybe they're, this is not the best term, but maybe they're being a brat, To me, I feel like what I've learned is that children's behavior normally kind of means something. They're trying to tell you something, but they just don't know how, and so they're doing the only thing they know how. So, like what are some behaviors that are, concerning that you think that they should seek therapy for?
Because I'm glad you brought that up. I hate that word brat.
I know. It's terrible. I know.
Because children, their behavior, like you said, has a purpose.
Right.
And it's our job as adults to understand that purpose. Because kids don't want to be bad. They love being good. They want to be noticed. But if they're not getting noticed in a cooperative way, they will act out. And so the behaviors that you might see in children who are experiencing anxiety or grief, or, they're experiencing clinginess again. You might see some regressive behaviors in terms of sleep patterns, eating patterns, toilet behaviors, but regressing back. But you also see a lot of irritability and a lot of just confusion. But that irritability you see in children particularly.
Yeah.
And so those are behaviors that would say, I need to look deeper into this.
Right. It's tough, man. Parenting is a tough gig. And, for me, just knowing that there are people out there who want to help and who can help and who are equipped to help, I know, do you have some resources you wanted to share? What are the other books you have over here?
Oh, these a couple. Another one I had is a good one. Anxious Kids, Anxious Parents. And kids will take their cues from their adults. And if you're experiencing a lot of anxiety and a lot of frustration, kids pick up on that. Mm-hmm. So there's a companion book that goes with it, which is called Playing with Anxiety, Casey's Guide for Teens and Kids, and how to help them understand what's going on with them and how parents can understand their child.
Yes.
Another one, here's another one for adults talking about death. It's an older one, but it still has a lot of valuable information in it.
Yeah.
Two other ones for children I have. Gentle Willow talks about the trees and the two tree doctors can't fix him.
Aw.
And so they learn about dying through this one. And then this one I know you said you just read, the Ivan Lifetimes. And that's a beautiful book because it's about lifetimes of people, animals, fish, butterflies. And it says they all have a lifetime. Some are short and some are long. So there's always a beginning and an ending, and in between is living.
Yes. Yeah, Ivan, he responded perfectly to that book. They really did a good job of laying out, plants, trees, animals, people. And he said, it's like sometimes they get sick and they, I forget exactly how they worded it, but as soon as I read the page about people dying, he said, that's what happened to Jackson. And I was like, yes, it did. And, and I asked him, did you like that book? He said, I love that book. And it's like, I don't know what it was, but it was just something that helped him, understand and make the connection. And, I certainly, I hate the reason, but I mean, I've seen him. He's a very empathetic child. He thinks a lot about others and he cares about others. And, I certainly wish that it didn't take this to happen, but without your help, I just don't know how I could have done this. And so I definitely want to thank you. And, is there any other pressing things that you want to share or talk about with grief and children?
I think one of the most important things I want to leave you with is, first of all, there's another book I didn't put on here. It's called The Whole Brain Child.
Yes, I was going to bring that
up. The Whole Brain Child by Daniel Siegel. I recommend everybody read that book, not just parents, adults, anybody who's around children. It helps them understand. And one of the biggest takeaways from that, and I use with parents myself, is when you're working with your child and you're dealing with your child who's having big feelings, don't try to solve things first, because we as adults have this tendency to want to fix things. And it's so important to connect on an emotional level first and then help solve.
Give an example.
Okay.
Because I watched you do this so many times, and it's hard. I'll admit that doesn't come naturally to me, and sometimes it makes you really realize all the stuff that as a parent that you kind of have to work through on a personal basis to be able to be in the right place to help your child.
So let's say I kind of remember a few times when Ivan was in our talking room first before we went to the playroom, and he wanted his treat, remember? Mm-hmm. And he would get so frustrated because treats were for at the end.
Right.
And so, but I want it now. I want it now. I said, Ivan, I can see you're really, really sad and disappointed that you can't have your treat right now because it's important to wait till the end. He went, yeah, okay. So it's just, you'll find so many ways to respond like that. Mm-hmm. And it just says to your child, you get me.
Right. I see you.
I see you.
Right.
I understand you. I get you.
Right.
And it's not just, I told you, you have to wait. No, I can tell you're really frustrated. And then sometimes it's just like, well, what do we need to do in order to get from here to there? Kind of thing.
Right.
Get them to help you solve the situation.
Exactly.
But connecting and then solving.
Yeah. Yes. I mean, to me, what you do is magic. And I mean, I know it's not magic, but it's, just watching. I've seen so many beautiful moments with you and Ivan, and I'm just beyond thankful. And I can't really recommend enough that if you think your child needs therapy, reach out. That's one of the things that I do is I try to provide, resources and lists to people. I don't know it all, but what I do know is that what I don't know, I will ask somebody else to help. And, how I end each episode is the quote from Ram Dass that says, we're all just walking each other home. And, we're working together to figure this out. I don't know how to do it. That's okay. You do. And we work together, and we've seen beautiful, beautiful things. And I'm sure you have a million stories of ways that, you've helped other families. And, we're all just trying to figure this out. So thank you so much for joining me.
So
I think you just gave some wonderful information. And so that's what we got for today. Thank you.
Thank you.